I'm really pleased to introduce you to two of our talented physicians who are going to walk you through how chronic disease is impacting many employers and what some leading-edge employers are doing to get control of chronic disease in their workforces. And our hope is by the end of the session, you'll walk away with a better understanding of this issue as well as some new ideas for what you could do to help either yourself or your clients address this important issue. First, just on an administrative note, I do want to tell you that we will be taking questions throughout the webinar, and we'll save some time at the end to answer them. If you'd like to ask a question, please enter it into the Q&A tab and then click Send. And now let me move to our physicians. So first, let me introduce Dr. Amer Desai. Amer is our Chief Medical Officer at Paladina Health. So Dr. Desai is a practicing physician. He's on the faculty at UCLA School of Medicine, and he previously worked in business as a management consultant for McKinsey & Company. For over a decade, Dr. Desai has led health system change, focusing on the design and implementation of innovative care delivery models that improve quality, reduce costs, and also transform the patient experience. Also here with me is Dr. Christiana Roberts. Christy is one of our wonderful Paladina Health physicians, and she sees patients daily, and she's going to give you an on-the-ground view of how she addresses chronic disease within her patient panel. She's been a primary care doctor both in and outside of the Paladina Health model, so she'll be able to share some perspectives of both of her experiences. And she'll do that by sharing patient stories with you to help you understand how this all plays out really in the real world. So before I turn it over to the doctors, let me take 1 minute to tell you a little bit about Paladina Health. Now, I know a lot of you are familiar with Paladina Health and what we do, but for those of you who aren't, we are what we call an employer-sponsored medical home. And many of you may be now saying, well, what's that? Well, basically through our program, employers are essentially adding a new physician option from which their employees and dependents can choose without any changes to their existing benefit plan. And why would you do this? Well, these physicians are dedicated to serving the employer's population. They're highly accessible through on-site and near-site locations and 24/7 cell phone availability. And they're also held accountable for delivering great care and service. And while this model delivers higher quality care, it also ends up driving down healthcare costs in 3 powerful ways, and you can see these 3 ways on the chart on the screen. So they redirect care into a primary care setting. They actively manage patient referrals, and they also proactively manage chronic disease. These are 3 really important and powerful levers to changing how healthcare is delivered. Now, we'll have future webinars that will discuss the first 2 of these factors, but today we're going to dive down into number 3, which is best practices in managing chronic disease. And with that, let me turn it over to Dr. Desai. Amer?
Thanks, Rebecca. To get started, I'd like to walk you through some high-level data on chronic disease. First, it's important to realize a full 3/4 of healthcare costs are spent on chronic disease, amounting to nearly $2 trillion annually in the United States. So what's driving this massive cost? Well, first, there are 25 million diabetics in this country, of which 7 million are undiagnosed. In addition, there are an estimated 67 million people who have elevated blood pressure or hypertension. As most of you know, diabetes and hypertension are both risk factors for cardiovascular disease, and in the United States, there are an estimated 26 million adults who have heart disease. In the self-insured population, there are significant numbers who may be at risk or are undiagnosed. And left undiagnosed, untreated, or suboptimally managed, these conditions obviously can have really serious health consequences that impact the individual's quality of life, their ability to earn a living, and can have serious financial consequences for the patient and the family, as well as the self-insured employer alike. The good news is that the conditions are treatable, and when managed appropriately, they can be significant benefit in terms of delaying disease progression and reducing complications. So let's explore further how the burden of chronic disease plays out in a self-insured employer population. So the data here is a study from the IMS Institute for Healthcare Informatics, specifically looking at healthcare spending for privately insured individuals under the age of 65. This type of data is probably familiar to most of you. The major point, if you look at the arrow on the far left, is that 5% of the population under 65 is driving approximately 50% of the healthcare costs. What's buried deeper in that number is that 1% are driving half of that total amount, meaning just 1% of this population are driving 25% of total spend. And if you look at the diseases among that 1%, 3/4 have at least one chronic disease. The bottom line, based on this study, is that the average self-insured employer may be spending over 80% of their healthcare dollars on a disproportionately small segment of their insured population. Now, if you take this one step further and break down the PMPM spend, or the per member per month spend across diseases, the people that drive the vast majority or disproportionate costs we just talked about are those with chronic disease. This chart shows that approximately 68% of the per member per month cost is coming from chronic conditions. Now, this study is from 2010, and considering that the per member per month has increased up to 8% per year each year since 2010, you can imagine that these costs may be even higher for the average employer today. So if employers can effectively manage the chronic disease situation in their population, they'll go a long way toward addressing the cost issue and mitigating cost increases. What's surprising in our experience has been how few employers really understand the true prevalence and burden of illness of chronic disease in their workforce.
Yeah, I mean, it's a great point, Dr. Desai. I mean, when you look at this chart, I mean, chronic disease really is and should be one of the most important issues on employers' radar screens when it comes to managing the health and health care of their employees. And and it is interesting because a lot of we talk to a lot of employers, and I think most of them recognize this, but how many people truly have an understanding of what is going on in terms of chronic disease in their workforces? And and on that front, we thought it would be interesting just to do a quick poll here of the folks listening in on the webinar with a sample question, and just see what percentage of you understand, what percentage of people in your insured population have diabetes. If you could take a minute and please complete the question in the quick poll that's showing up on your screen, we would appreciate it. Okay, well, great. Thank you all for doing that. It actually looks like about 2/3 of you think you know the makeup of your population with respect to the prevalence of diabetes, which is great. And that makes sense because many of you probably attended the webinar because you know you have chronic disease and you're looking for strategies now to help manage them. But for the 1/3 of you who don't know, and we encourage you to do so, ways you can go about that is you may want to talk to your broker or benefit consultant, and they can help you identify ways to analyze this among your population. Paladina also works with its clients to analyze the prevalence of chronic disease as part of a regular diagnostic process we do when evaluating whether Paladina would be a good fit for clients. So before I turn it back to the doctors here, I'd like to make one more point, which is a fairly disheartening one, I think, for everybody who's an American, and that is chronic disease is pretty high in our country, even among what we consider healthier populations. So if you take a look at this chart, I think it makes the point fairly well. Again, it's depressing, but it makes the point fairly well, which is it shows the prevalence of obesity by state in this country. And if you look at the healthiest state, which is Colorado, and this happens to be where Paladina is headquartered and where I'm sitting today, obesity is about 20%. That's a very high number. And as we know, obesity is highly correlated with many of the chronic disease that plague us today. Diabetes, hypertension, chronic disease, kidney disease. And this is getting worse over time. So relative to our health, even 1 or 2 decades ago, our health as a nation is not good and it's getting worse. So chronic disease affects us all these days. So if you're feeling like this isn't relevant to you, this issue isn't relevant because your numbers are better than others surrounding you, you might want to rethink this conclusion. You probably have a group of people in your population who are driving the vast majority of your costs, and they're also greatly in need of better care. So I'm guessing up to this point, for many of you, this information is not news. There are lots of employers that have been concerned about chronic disease in the workplace for some time. And many of you may have implemented a variety of different programs, including wellness and disease management programs, employee incentives, and on-site clinics, just to name a few of the many programs that people have tried. And what we're seeing that is, while some employers have seen some results with these efforts, they generally are incremental. There's certainly not a consensus that these programs are effectively helping improve people's health, drive down costs, and that's because they, for the most part, are not truly engaging patients with chronic disease the way they need to be engaged to achieve overall results. Well, a lot of these programs, they do some good things. They add some access points and so forth, but they're just not getting to the level of intensive engagement required. They may include one-off communications or touch points from various health plans or care providers, but again, they do not intensely engage the patients in a way that makes a difference. At the core of the Paladina model is a totally different and more intense way of engaging patients, and this is through the physicians who we set up to succeed with their patients in 3 important ways. And then, Amr, let me hand it back to you, and maybe you can walk people through what these 3 ways are.
Sure. So the Paladina population health model really brings together 3 foundational elements. First, access, second, engagement, and the third is accountability. And these elements are really collectively important at creating a very high-touch care team, patient, physician-patient interaction. So in terms of access, number one, we keep our panel sizes low for our physicians. Our doctors have panels about 25% of the size of a typical primary care physician. And what do these smaller panels do? I mean, they really enable our care teams to have what we call the gift of time to offer a high-touch care, longer appointments, and really guaranteed same-day and next-day access. We also allow for very convenient access through clinics that are on-site and near-site. And the near-site clinics are really critical as we think about dependent adoption and dependent engagement. And so then finally, the physicians are communicating in a number of different innovative ways. So rather than clearing a schedule in a typical provider's office with an in-person appointment, we aggressively use telephone and secure email as ways to have patients access the Paladina model. Second, we focus on engagement and proactively engaging our most at-risk patients with their physicians and care teams. So at a typical primary care physician's office, it tends to be quite reactive, really seeing the patients who end up calling in and making an appointment. Our physicians, including Dr. Roberts, as she'll talk about, reach out to their patients using risk stratification data to really differentially engage the patients who need it the most. And then finally, the third foundational element is really accountability, and this is accountability for our physicians and our care teams. Our physicians have a very transparent way of viewing into the chronic conditions present in their panels. We've built out outcome-based metrics into the compensation model for all of our physicians. And really, our physicians are recruited to join Paladina because they believe in the approach of population health management and having accountability over their panels. Now, I think what I'd like to do next is to have Dr. Roberts share some patient examples with you to help understand how the model works in the real world. Christy?
Thanks, Dr. Desai. I love this part of my job that I have so many stories I could tell you, but this in particular is one of them that I really think defines what we do. So I have a patient who came in. She only wanted to come in. She had an acute migraine. She had a history of migraine. She knew what she needed to do. So she got in there. Of course, we did the usual, take her vital signs, all that good stuff. and it was noted that her blood pressure was elevated. So we took the steps, initially to help her with her migraine, make sure pain was down, recheck some blood pressure, because obviously most of you guys know that pain can definitely increase blood pressure. While she was feeling better, I got the chance to actually talk to her about her blood pressure. She's like, oh, I knew you were going to ask me this. She's like, every doctor asked me this, but then they just say, oh, okay, we'll follow up and we'll take care of this. So the big thing for me is that I have the time to go over these things right away. And after chatting with her, she's like, oh yeah, I was on blood pressure meds, but I stopped them. And, I just haven't followed up. And she kind of giggled about it. I'm like, well, let's chat about it now. And digging further into it, she really had just used her primary care and, healthcare system in general for urgent care purposes only. She just thought her blood pressure wasn't that big a deal. She knew she needed to be on medication, but she kind of blew it off. So I was actually able to sit down with her and not only talk with her about blood pressure medication, but also why it is so very important for her to take the meds, meaning, this can lead to chronic kidney disease. This increases your risk for heart disease. It increases your risk for stroke. All of those things that because I have the time in my schedule that I can talk with her. And so part of this is we have great follow-up. So the next day, I called her, number one, to make sure that her headache was better, because obviously that's the most acute issue at the time. But also, I called her to see if she'd actually restarted her blood pressure meds. So luckily she had. She also, at that time, told me, I didn't tell you this, but I have a family history of kidney disease because of uncontrolled blood pressure. So she's like, thank you for saying something about it, because nobody has ever put it in that perspective that these things could happen to me. So it kind of was a great wake-up call for her. So she did restart her blood pressure meds. I was able to follow up with her weekly. And the nice thing is she works just around the corner. She comes to one of our near-site clinics. So she would come just during her lunch hour, able to get her blood pressure checked, and we can sit and chat for a little bit. And it took about 6 weeks to get her controlled, but we got her controlled. And 6 weeks in terms of medicine is pretty darn slow, or pretty fast, because usually in a regular clinic, I would not have even probably followed up with her for 2 weeks. That would have been minimally. And then probably I would have seen her every month after that. So I probably wouldn't have gotten her blood pressure under control for at least 3 months. I would not have been able to take the time to do phone calls. And this is a really common way for our patients to present to us, that they on the questionnaire we use, they don't put anything because they don't realize, oh yeah, high blood pressure is a risk factor, any of those things. And so they come to us with acute events. And at that time, we're actually able to take the time to discuss family history, medical history, all of those things. In my previous practice, there's no way I would have had this time. I really, I had 4 clinic rooms. My patients were stacked. I would get out of one room, go see the next one. And you're unable to really focus on these really important issues like high blood pressure that's uncontrolled. And what you do is you say, all right, we'll come back. We need to follow up just for this issue. And of course, the patient doesn't do that. So that's really the magic in this model is, I used to have so many patients. There was absolutely no time for me to discuss chronic issues during an acute visit. So unless a patient specifically makes a chronic appointment, then we don't have time to talk about it because you're already running behind and thinking, oh my gosh, my next patient is already behind. So I think that's one of the big thing, and the key to this situation really is that my panel is so much smaller, and this is exactly why Palladino works the way it does.
Thank you, Dr. Roberts. I think what may be also helpful for the group is to actually get a little bit into that's the access model, how it impacts a specific patient with high blood pressure. Let's talk a little bit about how you engage patients in a differential way in this particular model.
Yeah, so the great thing about this model is we're very, like you said, proactive in getting our patients in. This particular patient, he was one that we had risk stratified high because he had high blood pressure and known high cholesterol. He made an appointment for a comprehensive physical after we reached out to him saying, hey, we've noticed you signed up for Paladina, and let's get you in for a comprehensive physical. So during that visit, he actually expressed concern about possibly having diabetes. And like a lot of people, they go to a relative's house who has diabetes, and they're like, hey, I wonder what my blood sugar is. And his had been slightly elevated, so he came into the office. We did a blood sugar check right then and there in the office. It was well into the 300s, so we automatically can diagnose him with diabetes right at that point. Well, after exploring more, it's come to find out his blood pressure had never been controlled, and he was pretty sure his cholesterol was out of control, but didn't know the exact number. So during that very first visit, I was actually able to spend the time with him. Our comprehensive physicals, we schedule an hour and a half for every patient. So that's unheard of. The industry standard is 30 minutes for a comprehensive physical. So the fact that we have an hour longer than that really makes a huge difference, especially in people that end up with significant family history or significant medical history themselves. So during that visit, I was actually able to start medication, to talk with him about significant lifestyle changes, and to talk about why he needs to do these things, not just take these meds, but say, listen, diabetes can do this, this, and this. The hypertension does these things, and really able to focus on this is why I want you to do it, and to really get patient buy-in to the process. Because I can write as many prescriptions as I want. If a patient doesn't buy into the process, they're never going to take that medication. They're never going to start exercise. They're not going to modify their diet. But if they understand why they're doing this, it makes a huge difference in compliance. So the other part of this is great, is that once I got the lab results back and really confirmed where he was at, it was actually worse than I had anticipated. So we were able to do weekly follow-ups over the phone. And the way this works is he actually would email me all of his sugars and all of his blood pressure readings. And I was actually able to adjust medication over the phone. In these situations, he does not need a physical appointment to adjust the meds. Those numbers are the same as if he was in my office or if we're doing it over the phone. And this gentleman actually happens to work across town, so he'd have to take a half day off work to really come to the doctor's office. So we set up weekly phone calls, and I was actually able to get everything adjusted with that little bit. So he actually only had a few in-clinic appointments. Everything else was handled over the phone. In previous practice, phone calls are an afterthought. You know, it's if I have time, I'll call this patient, or maybe if I stay a little later, I'll call this patient. But in the Paladina model, as a physician, I am able to block out my schedule for a phone visit. Engagement is so very important that phone calls are almost, if not just as effective as an actual clinic visit in most cases. So this guy, we were actually able to get him under control in 8 months without insulin. And where his levels were in previous practice, I would have just started him on insulin because it was the easiest thing for me to do, not what was easiest for the patient. You know, and so we were actually able to get through these things. And with our weekly phone calls, we didn't just discuss numbers. We discussed, did you have a good week? Did you have a bad week? How are things going? How's the weight loss? You know, and a lot of people, they have bad weeks. And it's not so much having one bad week, it's having multiple bad weeks. And so we were able to discuss these speed bumps that he had, you know, a few roadblocks and getting some more exercise. And we were able to do all this stuff just over the phone. This model, that's the magic in this is really the access for the patients. You know, that you can call your doctor and they're going to call you back immediately. You're not going to get an assistant. You know, and so the flattering thing for me is that this patient, his wife was actually employed by the company who paid for Paladina. He chose, after his wife left the company, he actually chose to stay on as a paying client. And he now pays out of his pocket because he so appreciates the care that we've been able to give to him. And in his words, he says he can't imagine going back to the old way of medicine.
Yeah, I think the engagement really highlighted in that case example and high-touch follow-up is critical in improving outcomes. And what I'd like to do at this point is share with the group a case study of how this works for one of our clients across their population. Now, this chart basically, if you go from left to right, each bar represents a segment of the population based on the number of risk factors or chronic diseases that they have. So you can sort of see on the left is 4+, and then on the far right is people who have none. And the idea here is really to highlight the point that in this case and across the board, our physicians are looking for opportunities to engage patients with higher risk or who have higher burden of chronic disease. And in the data in here only represents kind of logged treatment interactions, which is oftentimes in person or by phone, and not necessarily the number of email type interactions that we also do. So again, highly kind of differential interaction and proactive interaction with folks who have greater risk.
So, and this is a really important area. You know, we talk about accountability, and in previous practice, accountability meant how many patients are you seeing a day. So in this model, our accountability is focused on outcomes, not volumes. And that's what's so significant about how this model works. So I have tools at on my computer that really help me know where my patients are. So right off the bat, we have a known risk pool. So we have a patient fill out a little survey that's very easy that tells us what their risk factors are. So we are proactive, and I myself, the physicians, we call these patients who are high risk to get them in the clinic as soon as we can, because we know that's what drives the expenses, and we want to control them as fast as possible. So not only that, but the undiagnosed patients are really important also. So like I said, the proactive reaching out to patients to get them scheduled for their physical exam is so very important. You know, getting a 45-year-old male in who hasn't seen a doctor in 15 years really is no small win for a doctor. It's really important to get these people in here. So we're really hoping to get as many people as possible into our clinic. And you can see, you know, we're incentivized as physicians to get our patients in for their comprehensive physicals. Tomer, it's back to you.
So, excuse me, I was on mute there. What the couple points here is that those last two case examples are obviously at the patient level. This also leads to very distinctive results at the population level, right? And the next couple of charts, what I'd like to do is show you a little bit around some of our results that we've had. This is from a particular client example where we have longitudinal data on blood pressure control. So on the left side of the chart, we have approximately 52% of the folks who have a diagnosis of hypertension under control. And on the right side, you get to see folks who are, again, Paladina members who, in their last reading, 87% of the patients had their blood pressure under control. Now, those results are impressive in and of themselves in terms of relative improvement relative to baseline, but from an absolute standpoint, when you compare it to commercial HMO benchmark standards, again, which is approximately 70% for this HEDIS metric, the Paladina members outperform significantly. Now, again, the population health model that we're talking about, the foundations of access, engagement, and accountability is designed to deliver results far beyond simply just chronic disease, although that is an incredibly important part of what we do. This data is some of our data from preventive cancer screenings for cervical cancer. And what you can see here is in a client example, on the left side you have non-members and what percentage of the population actually had their pap smears done according to evidence-based guidelines. And then on the right side is the Paladina Health membership. And again, significant improvements when people enter the Paladina Health model, leveraging the access, the engagement, and then accountability that the physicians have for their panel. And this is all part of the Paladina Population Health Management Model.
Thanks, Amar, and thanks to both you and Christy. And you know, the physicians have given a lot of great detail around this. You know, just to pull up in terms of what I see as the key takeaways at this point is, you know, hopefully you have an appreciation for the importance of chronic disease. I mean, a small percentage of people in your population are likely driving a huge amount of your healthcare costs and are in great need of help. And you know, and so that's, you know, something I think, you know, we all appreciate. And then the question comes, so what do we do about it? And I'd like to just give you three hopefully tangible steps to think about. The first one we already touched on, which is making sure you really understand the prevalence of chronic disease in your workforce. And not only, you know, what is the percentage of people who have diabetes and hypertension and so forth, but how much of your cost is it driving? The second question I would ask you all to think about is understanding how your current health benefit plan is incentivizing accountability and how much is it encouraging your employees to take better care of themselves. So questions like, are your current benefits motivating employees to play an active role in their health care? Do you know whether your employees have easy access to resources to manage their health? And how are your dependents with chronic disease being engaged? And then the last step, as we discussed today, and I would argue it's the most impactful one you can take, which is actually engaging accountable healthcare providers to partner with you in managing your employees with chronic disease. So thank you all for coming on this journey with us today, and I hope it's been helpful for all of you and has given you some key factors to think about and some new strategies to consider related to how to address chronic disease in your workforce. As I said, this is important stuff not only for your organization's bottom line and productivity, but it's also important to improve the quality of life for your loyal employees and the people who serve your organization every day. And with that, I'd like to open it up for a few questions. We saved a couple minutes for this. We have one here, which is a great question, which is how do you keep your panel sizes small enough to provide this level of care? And for those of you who don't know, at Paladina, we typically have panels for each physician that are about 70% smaller than what you might find in a traditional primary care practice. And you know, that sounds like a great thing, but how do we do that? The answer is this. Our physicians, as you could hear from Christy's stories, are actually providing a whole lot more care than what a traditional primary care practice would do. In a traditional system, a patient is just bopping around the healthcare system, having healthcare transactions in a lot of different places. They're going to urgent care, they're going to retail clinics, they're going to the hospital, they might see a primary care doctor, they might see a specialist. Our physicians are trained and they have the time to treat 80 to 85% of the care that a typical average person needs. And so a lot of the care that might have been going to an urgent care clinic, or you know, some people may have been going to see an endocrinologist to help get their diabetes managed, are now coming to our physicians. So lower volume of patients, but more care per patient. Thank you for that question. That's very good one. We have another question here, and I am going to pass this one on to Dr. Desai. And this one is someone saying that they've had an on-site clinic for 5 years with no results, and they want us to explain how this would be different from their experience. Dr. Desai?
Thanks for the question. So I think really important in this is that this is certainly not intended to be a typical on-site clinic both in terms of the way the clinic is staffed, nor in terms of the type of scope of services that can be delivered. Remember, this is a high-touch physician access model, and it's intended to be done in a highly convenient way that is technology-enabled, and really to provide the broadest scope of primary care services possible. And most on-site clinics, because of how they are staffed, in addition to the fact that they are truly on-site with limited hours, et cetera, cannot do that in terms of who's working at the clinics, as well as how patients are able to access that clinic. So between the combination of on-site as well as near-site options, the fact that it is staffed by a physician with 24/7 availability, and then importantly that it's enabled through technology to be able to proactively reach out to the patients at risk and use data to help inform what the care teams are doing, it is very different than most on-site clinics. And the last point I would make is, most on-site clinics that we've certainly had exposure to, still tend to be places where people go when something is wrong. They tend to be kind of what you might see at a typical primary care office in some respects. They're reactive in nature, and there isn't that element of how do I go out and manage this population proactively with the, armed with the right data, and frankly armed with the ability to form really distinctive relationships with these folks so that you can actually get the changes in behavior that are so important in getting chronic disease under control.
Great. Thanks, Amar. We've had a number of other questions come in around the topic of reimbursement and how much does it cost for our service, and kind of how do we earn an ROI? And I'd be happy to take that one, and we're happy to discuss specifics with people as well in follow-up. But generally how our service works is it plugs into existing benefit programs for self-insured employers. And so there's no need to change the benefit plan. You will still have claims coming in through your TPA if you're a self-insured employer. And so your claims are still coming in. And then Paladina Health is a subscription model. And so, we earn, kind of our living on a per-month fee per patient, regardless of how much care they get. So it's fixed, it's predictable. And the way we earn an ROI is by eliminating more claims from the fee-for-service claims that come in than what we're getting paid. It's very transparent, it's very measurable. What we typically do for employer clients is we work with their brokers and benefit consultants to get a download of their historical claims. And we actually look at what their historical expenses have been in the healthcare system, and that really sets the baseline. And then when we deploy Paladina Health physician and clinic, we then get to look and see what's happening once we put those in place. And so you can literally look, if you had $350 per person per month spending before Paladina Health, you can actually look and say what happened to the claims expenses after we put Paladina Health in. We typically reduce, just on average, we eliminate at least 35% of outside claims. It varies, but that's kind of a rule of thumb, an average that we're seeing. And once you add back in our fees, are you lower than where you started from? And we have a number of different kind of pricing programs and so forth that make sense for employers of different sizes. And again, happy to talk to people specifically, because I know there were a number of questions that came in. But I think part of the key is very transparent, and secondly, it gives us the right incentives. We don't have, like most of the rest of the healthcare system, we don't get paid more for doing more stuff. We're accountable for patient satisfaction, for how well we're helping your people with chronic disease, and so forth. Okay? And then one final question here I'm going to ask Christy. This came into her, and the question was around someone who has a lot of overweight employees in their population, and just wondering how you would engage those types of people.
Yeah, so the great thing about Paladina is we have the time to take to talk with our patients. So when we do our comprehensive physical, we discuss pretty much everything. So if you have elevated BMI, or obesity or being overweight, we actually have the time to take with our patients and talk with each of them about healthy lifestyle, and not just go, you need to eat better or you should be exercising more, but specifically going, how can we get you to do these things? And every patient is an individual. One of the great things we were able to do here in Denver is to pilot a Fitbit program. And as a part of that, patients come in to do their comprehensive physical, and we talk about fitness in general for these people. So we were actually able to set goals. So not just activity goals, but also nutrition goals for people who needed to lose weight, their weight loss goals. And we followed up with them on regular intervals to see how they've been doing. And I've gotten just amazing feedback from patients because it really shows how much we care. That, these patients before have just been told, you should be eating a low cholesterol diet. And they're like, well, what is that? And we actually have the time to go through and have resources to show them to keep them on track, but also we've made it to where they're accountable. The clinic is so easy to get to. Like I said, we either have near site or on site. I happen to work at a near site clinic, and it's just around the corner, so they can come in even just during their lunch hour to weigh in to see how they're doing. And this is all part of that comprehensive care that Paladina is trying to provide for all of our patients.
Great, thanks, Christy. I'm sure you'll be seeing a lot of people right after the new year. So with that, I know we're a couple minutes here from closing. I want to thank Dr. Desai and Dr. Roberts for their time today. And one last housekeeping note: we will have a recording of the webinar, and it will be available later this week. You can just check back at paladinahealth.com/webinar replay. And then I'm also excited to announce our next webinar, which is going to be how to interpret your claims data to improve care and lower costs. And so we'll actually go through one of the analyses that I referenced before. That will be on February 25th, also kind of starting at the same time, noon Mountain Time. And we will be sharing real claims analysis data for one webinar attendee. In fact, if you'd like to be considered to have your claims analyzed, you can come to our website and register for that there. So again, thanks to everyone for attending, and we look forward to seeing you on a future webinar. Thank you and take care. Have a great holiday.